the voice problems or disorders of the voice. Hoarseness of voice is a common ENT OPD attendance. Hoarseness means rough in the voice or voice has gone rough. This is not normal or the voice is broken. Before we talk to the actual topic, let's quickly revise. The anatomy. You know it. The larynx consists of cartilages, membranes, and muscles. The cartilages are divided into paired and unpaired. The most important of them are cricoid, thyroid, epiglottis, arytenoids, and the smaller ones are corniculate and cuneiform. There are small muscles in the larynx, which are known as laryngeal muscles, which are intrinsic and extrinsic. They all work together to give a functions of larynx. Most of the larynx is supplied by vagus nerve through two branches, superior laryngeal and a very important one, recurrent laryngeal nerve. We all know it. It's just a quick revision. This is the quick look at the larynx through a mirror. How it looks like during deep inspiration, the left side, and on the right side during the expiratory phase. Now physiology of speech is it's got pulmonary phase when the lung inflates and air is getting into trachea. We have a laryngeal phase when the column of air which is forced out vibrates the cord. Then there's the oral phase where the sound is amplified by the air present in the chambers of the oropharynx and laryngopharynx and is articulated into a speech through lips, pharynx, tongue and teeth, etc. Hoarseness is made at the laryngeal phase. Problem at the laryngeal phase, hoarseness appears. This is a quick picture of how we inspire and how we talk. Coming to the function of larynx, these are the important function of larynx, and the most important of them all is you want to go back, go back, go back. To make a proper sound, we need all these four factors for a vocal cord. They should approximate properly. They should have appropriate size. The stiffness and tenseness should be normal, and the mobility should be normal. They should be able to vibrate. Hoarseness can result from one of these factors when there is a loss of approximation of the cords, when there is a variation in the size of the cord. When there is some edema in the cord, or the stiffness is changed, or vibration characters are disturbed because of congestion, because of bleeding, because of nodules or something. Now coming back to the functions of, okay, these are the functions of the larynx. The topmost function is airway protection. It has to protect the airway. It doesn't allow anything else but gases to pass through the larynx. The rest of the functions are phonation, let the inspiration and expiration take place, fixation of the chest muscle. So the topmost job of the larynx is to protect the airway, not the speech. When we deal with a patient of a hoarseness, We have to take all this history in depth and in detail. We have to ask how long problem has happened, what was the onset, was it sudden, like we have infections, laryngitis, viral laryngitis, bacterial laryngitis, or we have allergic edema, or if it is long standing, then we know this is a habit related. We got to know the occupation and job of the person. There are a lot of jobs which are dependent on the voice use. For example, teachers, actors, singers, they have to use their voice at various tones and various intensities, and that is their blood earning. So the occupation is also important. Habit also matters. We know that there are some people who are very silent workers, talk very mutely, especially the urban people, those who live very close by, and people coming from rural areas, they are louder to talk because their distances are far. They have a lot of social distances and they talk loudly. That's habit, but it does produce some sort of stress on the vocal box. We got to ask about some associated complaints, especially of heartburning, regurgitations, because we know that acid and pepsin of the gastric secretion can affect larynx and esophagus. We also have to ask about some other associated diseases like endocrine, especially diabetes and thyroid disorders. Trauma is important cause. We have to ask about any history of intubation, neck trauma, or any previous surgery. Very common cause of hoarseness we will deal later as we proceed further is surgery. We'll talk in detail which surgery is very important as we proceed further. While we examine, we always examine patient as a whole. Look at the general condition of the patient. Is he comfortable sitting or talking, or is he got stridor or difficulty in breathing? Is he anemic? Does he appear wasted or look? So look how the patient is pretty important. Then we proceed to the local examination of the our area, which means nasal hygiene, throat, uh, ears, and of course larynx. There are various ways of looking into the larynx. Commonly in our ENT OPD, we deal with a mirror, call it indirect laryngoscopy. Then we examine, of course, head and neck, chest, cranial nerves as well to determine are there any cranial nerve paralysis, especially the lower 9, 10, and 11 ones, which are involved with throat and larynx. This is how we perform indirect laryngoscopy in our clinic. We have a preheated mirror which is gently lifting the soft palate. I'm holding the tongue in my soft, my left hand, and my showing, light is showing right at the mirror, which is being reflected down at the larynx, and the mirror inferior, a reflected image is being formed in the mirror, which looks like this. As the epiglottis, there's the retinoids, these are cornicular cartilage. White stuff is a vocal cord, true vocal cord, true vocal cord, where am I gone? And right above them are the pinkish false vocal cord. And this is we are looking at the tracheal rings. And in the gap in between is known as rama glottis, or the glottic space. This is in between. So very good view of larynx can be obtained in a majority of the patients through the indirect laryngoscopy mirror. Uh, this not only gives you anatomical appearance, it also shows you pathology and functions of the mobile vocal cord, mobile or not mobile. Now, there are some investigations which all the patients of hoarseness or some of the patients of hoarseness will be needed, like Bessie lab. Sometimes you need chest X-ray to rule out any pathology in the chest, i.e. any masses in the chest, especially in the apices. Endoscopy will also matter. We have flexible endoscope and rigid endoscope. We'll talk in a minute. The importance of and advantage of each. And we can do deep scopies of esophagus or bronchoscope if necessary. And scanning will also help in determining any tumors, masses, or involvement of larynx through this thing. If needed, thyroid profile is also important in cases where we are suspecting thyroid disorders. Now, flexible laryngoscopy is a quick one. It has some advantage. It's very well tolerated. It's cheap one. Whereas not all patients can tolerate. Some of the time, gag reflex prevents us, and sometimes a very long, prolonged epiglottis which blocks our view. In those cases, we have to do flexible laryngoscopy by passing a flexible laryngoscope through the nose and examining right larynx from top. This has a very much advantages of well tolerated, full thorough examination, and if you have a video camera, you can document the pathology and function as well. Disadvantage is a little bit expensive and needs more time. Rigid laryngoscope needs general anesthesia. It's a rigid instrument, has to be passed, patient has to be asleep. It gives a very good image, and the larynx is at you can take a biopsy. Otherwise, flexible one, very difficult to take biopsy because larynx and trachea are mobile structure. They have the side effects of being expensive, complications of anesthesia and rigid instruments, and side effects of the rigid instruments. Okay. Now, these are some of the causes of hoarseness of voice. As before, I always start from congenital causes, like somebody could be born with laryngeal waves, hemangiomas, lymphangiomas, or ventricular cysts. We occasionally get these problems. Usually, these are acquired causes, and when the common acquired causes are, again, could be inflammatory, like acute inflammation in a viral laryngitis, as we have through influenza, flu, in exanthematous diseases. Sometimes you can have bacterial inflammation as well. You can have chronic laryngitis as well, especially specific ones like tuberculosis, leprosy, and they will have their own sign symptoms. It could be a neoplastic one causing problems in the larynx, like a small mass on the vocal cord, papilloma, or a malignant one like carcinoma or lymphosarcoma, lymphomas. You can have traumatic causes. Very common trauma is in the ICU people where people are using for ventilation. We want to pass endotracheal tube, and that can cause damage or trauma, laceration or abrasion to the vocal cords. Nodules are very common in people who are screamers, shouters, and teachers. We'll talk in a minute. RTA, larynx is directly involved in a road traffic accident or in a sports injury, you will have problem. You can have neurological problem in the way of vocal cords being paralyzed. If you have problems in the nerve supply of the larynx, you will have hoarseness of voice. Myxedema is a very common example of endocrine disorders, and one of the topmost vocal cord problems causing vocal cord paralysis are doctors. Surgery especially at the thyroid and in the neck for malignancies can result in vocal cord paralysis. So these are some of the common causes of hoarseness of voice. Now these are some of the picture views of laryngeal pathology like acute edema. We have allergic edema because of cold or some allergic. Both vocal cords become swollen and you lose voice, become aphonic for some time. Venous edema is because of chronic damage to the larynx, chronic trauma, resulting in this subepithelial edema, causing hoarseness of voice, irregularity of the vocal cords. These are the vocal nodules, pretty common in people who are professional voice users like TV anchors, teachers, screamers, singers, professional actors, religious preachers. They all use their voice a lot at various tones and intensities, and they can traumatize their larynx if they are not using appropriately or judiciously. And these are the area where larynx get maximum trauma, anterior one third with posterior two third, and with this trauma, it gets organized and becomes nodule. Unless the trauma is removed, the nodules are formed and they cause hoarseness of voice because the vocal cords are not meeting appropriately. So the treatment will be, of course, after investigation and confirming a diagnosis, the treatment will be voice rest, excision of the nodules under microscopic guidance. Ideal would be laser if you have laser under microscope, and then speech therapy to change his speech pattern, change his abnormality of speech production. These are laryngeal papillomas which we used to get in juvenile populations because of some viruses. They are contagious, they are in multiplicity, and they cause hoarseness of voice, disturbed cry, as well as stridor, depending on how many and what are the size of these papillomas. They used to be very difficult to treat until the lasers were came into picture, and then now the treatment is not that difficult. They need laser ablation. This is a glottic granuloma. Uh, Rough intubation will cause local damage to the vocal cord, which may result into granuloma, cause hoarseness, and may be occasionally difficulty in breathing. If the granuloma becomes larger one, it will become polyp, a solitary polyp hanging from the left vocal cord of this patient will cause hoarseness of voice and noisy breathing. We have to rule out any sinister pathology with this polyp. So you can diagnose it, but you confirm your diagnosis with histopathological support. So always send it for a histopathology. These are vocal cysts, these are congenital or acquired. These are also because of abuse of voice. Sometimes you can have white patches on the vocal cord. Vocal cords are white, but they occasionally get very, very big white patches. They get stratified squamous epithelium. Squamous epithelium becomes stratified. You have to rule out any serious dysplasia or malignancy of the vocal cord. So, hoarseness, you examine under direct laryngoscopy and take a biopsy to prove that this is a dysplasia and not carcinoma by only by histopathology. This is how a malignant growth, suspicious malignant growth will look from the right vocal cord going up to the anterior commissure and reaching the left vocal cord as well. That's a bigger growth involving the entire posterior commissure of the larynx. This is how laryngeal malignancies will look like. We have to, of course, take biopsies and confirm whether malignant they are, what is the type of the malignancy, and then stage and treat. Madam Chanela will take the next lecture and talk in depth laryngeal carcinoma. We'll skip laryngeal carcinoma after this slide. Our CT scan showing a growth on the right side of the patient along with the glottis. This is a transglottic growth involving the paraglottic spaces. And coming to the causes of the malignancy of the larynx, common malignancies of the aerodigestive tract are because of smoking. Smoking is a common sinister. We all know it. Okay, next we will go to the next phase of our topic, which are vocal cord getting paralyzed. As we discussed, causes of hoarseness, one of the causes can be vocal cord palsies. Now we will discuss at length what may be the cause of a palsy of the vocal cord. As we know, we have two vocal cords supplied by recurrent laryngeal, all the muscles except the interarytenoids. The most important muscle of the whole body is our posterior cricoarytenoid, which is the abductor of the larynx. It opens the larynx. This is what happens when we breathe, deeply breathe. The abductor of the muscles, vocal cord open and get us breathing. So all the muscles are supplied by recurrent laryngeal except the interarytenoids. The etiology of the vocal cord palsy could be again congenital one or acquired. Among congenital could be birth traumas, malformations of the brain like hydrocephalus and capuloceles, etc. We'll skip the congenital cause and go to the acquired causes. Among the acquired causes, topmost come the trauma. First trauma is the iatrogenic trauma when we operate for the thyroid. Thyroid surgery used to be a very common cause of vocal cord paralysis. Nowadays, thyroid surgeon, head and neck surgeon are especially trained to dissect during the surgery the recurrent region nerve, demonstrate, and then try to preserve it during the surgery before doing thyroidectomy. So, clear demonstration of recurrent region nerve is a mandatory nowadays. All the head and neck surgeons and thyroid surgeons are trained for this. But before that, it was very common to have a vocal cord paralysis, either one or both, with thyroid surgery. Neck trauma, either surgical or artery or sports injury, can also result in vocal cord paralysis. Some of the tumors can cause problem, like thyroid tumors, malignancies especially. They go and invade recurrent lesion nerve at the junction of entry of the recurrent lesion nerve into the larynx, which is the cricoarytenoid joint, or by metastatic lymph nodes. See, bronchus and esophagus can also involve the recurrent lesion nerve. Neurologically, if you have cerebrovascular accidents, you will have problems of vocal cord palsy along with other neurological symptoms. And in almost one third of the cases, we will never find out the cause of vocal cord paralysis. We call it idiopathic. But we still try to find out by doing the investigation which we enumerated beforehand in the causes of hoarseness. Now, one of the recurrent lesion nerve can be involved, or both recurrent lesion nerve can be involved, either right or left. The common one is the left one, more common to go as compared to right, because this has, we know the anatomical knowledge, this is a very longer route of travel. It starts from the chest and goes right up to the neck. So these are the common causes of recurrent lesion nerve, right and left. And the neck, in the left side, you'll increase another causes of the mediastinum, like lymphomas, tumors, or metastatic lymph nodes in the mediastinum. Otherwise, thyroid surgery takes the top, and trauma and malignancies are on top. This is a composite slide which shows you, taken from expert docs, which shows you paralysis of the vocal cord could be due to interruption of the nerve supply. This cord is not moving at all. Okay, congenital causes are very second common cause of the congenital causes. You can have a trauma causing this thing. Cancer can also cause, as we just mentioned before. Left vocal cord is more affected than right one. Of course, we just mentioned about smoking. Symptoms are hoarseness of voice, fatigue, weakness, difficulty in breathing, depending how many cords are involved. Both vocal cords will give symptoms of stridor. Diagnosis is done by laryngoscopy, indirect as well as direct laryngoscopy, and treatment comes later. We'll talk in a minute. So we can have vocal cord paralysis, either unilateral or bilateral. It may present with disturbed voice, cough, difficulty in breathing, difficulty in swallowing, or choking on breathing, or swallowing, especially in the bilateral cases. This is a picture we're showing the left vocal cord staying in the pyramidal place and the right vocal cord moving abduction and adduction and trying to give a good voice. This is compensating for the left vocal cord. Now, sometimes one vocal cord palsy may pass even unnoticed. It may be just totally asymptomatic. So here is a comparison of unilateral vocal cord with bilateral vocal cord paralysis. One cord remains fixed, they're unable to adduct fully and leaves a gap in between. So may cause symptom or may cause nothing. Just the voice is a little bit breathy and may sometimes aspirate during swallowing. Bilateral vocal cord will be, both vocal cord will be fixed in the midline or near to the paramidline area. The airway will be reduced, compromised, giving rise to airway obstruction, causing stridor. Treatment of unilateral vocal cord will be to medialize the vocal cord, which is in the paramedian or lateral position, to push it with injection of chemical substance known as Teflon or a fat or a collagen. And treatment in case of vocal cord, bilateral vocal cord paralysis will depend on how the patient is presenting. Most of them will need care of the airway, which is getting difficulty in breathing. Initially, we give steroids and try to top it up. But if things don't improve, then a tracheostomy may be needed, or later on some definitive surgical procedure to, to give patient a wider breathing channel. But in that case, when the channel has been given better to breathe, there are chances of aspiration while eating or swallowing. So patient has to compare and choose which one he wants. He wants a difficult breathing, or he wants to have an aspiration during swallowing. a difficult problem treating a bilateral vocal cord paralysis. Sometimes the larynx is so bad that he cannot guard his larynx, his lower airway. One has to do a total laryngectomy in case of bilateral vocal cord paralysis, when even tracheostomy cannot defend the larynx. So coming back to management of unilateral vocal cord paralysis, we try to find a cause by history and investigations. And as I said, it may pass unnoticed and maybe just a chance finding to the ENT surgeon. Usually we wait for 6 months to 9 months for a spontaneous natural recovery or a compensation by the opposite cord. And occasionally you need, if it doesn't work, if the compensation doesn't take place, we might need to push the paralyzed vocal cord by repeated injections of Teflon or by fat or collagen to improve the voice. The bilateral ones are difficult to treat. If the patient is going in a starter, we have to help the airway by steroid or by tracheostomy. Sometimes thyroplasty may be needed to remove the vocal cord. Now we're coming to our last part of the affection of the larynx, which is functional, when there are not much structural problem, but there are function of the larynx are disturbed, like ventricular dysphonia, double voice, false vocal cord is being used instead of true vocal cord for the voice. Voice is rough. Similarly, next one is functional aphonia. These are ladies, young ladies who suddenly become a voice, no voice at all. They have depression and hello. They have a depression and suddenly lose their voice. So you have to diagnose the case and refer to the psychiatrist. Next one is pigophonia. These are male, which are mentally not mature. They are totally dependent on their mothers. They keep their children's voice, childhood voice. This may be helped by psychotherapy as well as by this process. Guzman's maneuver. You press the thyroid cartilage while talking. It might help. Otherwise, you also need psychotherapy. So weakness of voice, a small problem is stammering. Some of the children are stammerer as an adult as well. This is a very common in the early age, but if you keep on taunting the subject, this get fixed in their habit and it become very difficult. Otherwise, the idea is to ignore and the child will grow out of stammering. Not to worry. Anolalia clausa and anolalia aperta are other topics in which when you have a cold, like cold, you sound like a blocked nose. The resonating chambers of the nose and sinuses are diminished. Is opposite to this Lenonelli aperta. When the palate is not working properly due to neurological or habit formation, your nasal sounds is increased and it appears as if you are losing sound through the nose. So these can be treated by speech therapists. Now please remember, speech therapy is a very important integral part of voice treatment along with ENT surgeon. So in summary, we can say it's a common symptom. It's not a disease. Many causes we diagnose with the history and investigations, and treatment depend definitely on voice rest, definite voice rest, speech therapy, and surgical or medical therapy. Lasers are very useful in surgery. Same is vocal cord palsy, common cause. Left palsy is commoner than the right one, and the important causes are surgery, thyroid surgery, cancers. Unilateral may be asymptomatic. Bilateral is very difficult to treat, and single nodule and carcinoma could be reduced by a preventive measure by controlling the way we talk and by reducing the smoking and alcohol habit. Thank you very much. Please stay there while I take the attendance. Thank you. Recording. Ruth, please stay there. Huh? We're taking attendance. You also send the attendance.